It's a pleasure to serve under your chairmanship. And I'd like to start off by congratulating the member of Ealing Central and Acton for securing this debate. I was delighted to support her in her bid to the Backbench Committee to be able to have the opportunity to debate this incredibly important issue. An issue that is, the NHS is a source of great pride, and people are very protective. Londoners are particularly protective of healthcare in that area. None so more than in Sutton. I'll speak about my local area, but I think actually it will be a similar story and a similar tale around London, and the issues will be very similar. People in Sutton for many years have talked about St Helier Hospital. It's a focal point of the community. It's a focal point of local healthcare. I've been there. I serve as a volunteer at the hospital. I go regularly to feed people on the stroke ward, and I try and maintain that now. Even now I've been elected, it gives me a great opportunity to go in and see people on the front line. And I've also been a user there as well with my family. The member for Doncaster North before the last election weaponised the NHS. I tend to weaponise my mum's use of the NHS. You know, she's been in as from sheltered accommodation. She's taken a couple of falls, and St Helier has treated her really, really well when she damaged her hand and fractured her hip. St Helier has a particularly good hip fracture unit that is renowned across London and indeed the country. Now, St Helier and Epsom Hospital Trust actually is predicting to run a deficit at the moment. This year, despite hard work to try and break even as they did last year. Now, members on the other side may use this as a brickbat to throw at the government and look at funding, but actually that's to fail to look at some of the symptoms behind what's happening in St Helier Hospital in particular. The building has been crumbling and is getting beyond use for many, many years. But ever since I've lived in Sutton for 26, 27 years, there has been a political campaign, primarily from the Lib Dems in my area, but also other parties, trying to save St Helier, scaring people into believing that the hospital is imminently going to close. And what that's actually done by using it as a political football, it's actually failed to get some sort of consensus, some sort of agreement to how we can actually protect healthcare and build a really effective healthcare system in Sutton. Because by having that deficit, what the chief executive is going to be needing to do is tackle that deficit without compromising quality. And the maintenance of the building, indeed.
Just on the issue about the threatened closure of St Helier Hospital, I mean, maybe I've been here for longer than I should have been, but I seem to remember the... thank you. I was hoping to get that response. But I seem to remember that a government minister resigned in order to fight the campaign to defend St Helier Hospital, and he should have known what he was talking about because he was the health minister at the time that he resigned.
Obviously he didn't, which is why I won the election against him. Well, actually, I mean, it's funny because actually I think the tale was that he resigned, but I don't know a lot of ministers that actually tend to resign to save a hospital when he's actually one of the ministers in charge. I think, others have reported that he was sacked. I don't know the truth, frankly, and I'm not sure we'll ever know.
Just for the sake of clarity, I'm in the next door seat to my honourable friend, and many of my constituents look to the St Helier Hospital. There was an outrageous campaign run by the Labour Party in 2014, completely without foundation, about the hospital closing. And it was run in time with the local government elections, at a time when both the government and all of the people at St Helier in management and all the board papers showed there was no plan to close the hospital. It was exactly as he said, a scare story being run.
Scully.
Thank you very much. I'm grateful to my honourable friend for making that point, and he's absolutely correct. And this is why we need some degree of certainty. We've had for many years now, we've had the better health care closer to home, we've had better services, better values. It's alphabet soup of NHS changes with no degree of certainty for residents, but also for staff in that hospital. The BSBV review, a lot of that was clinician-led, but it was based on the premise that they wanted to concentrate consultants in my case, St George's in Tooting, so that they could, because they didn't have enough consultants in each of the different hospitals, seeing enough of the more unusual cases, so they wanted to concentrate expertise. Now, if you imagine, therefore, if you've got a whole load of politicians in Sutton telling you time and time and time again, and telling residents that the hospital's just about to close, as my honourable friend mentioned about those stories, imagine if you were a newly qualified consultant. Where would you want to go and practice? Would you want to go to a hospital that you're being told is just about to close down, or would you want to go just up the road where you know that all of the plaudits are, all of the concentration are? I know what I would do, frankly. And that's why I think that it starts to become a self-fulfilling prophecy, that if you talk down your local hospital, if you talk down local healthcare, then you're really in danger of getting the exact opposite result that you seek to do. The fact of the matter is, with St Helier, is very much.
The honourable member is making a point, but there are services that have closed or moved without political problems, shall we say, because the people who use them and have valued them have realised the change is necessary. And I suggest that the changing nature of stroke and trauma services over recent years was the right thing to do, fewer, larger, better. Therefore, I'm suggesting that the opposition to changes that the honourable member is mentioning is actually because people are genuinely worried that the solutions provided are not going to provide the adequate services of the future that we all want for London. And in addition to that, what is happening in recent years is the significant rise in population in London that we are all seeing, not that we oppose that per se, but that we feel that the health service in all its facets should be seen to accommodate and grow and accommodate to take the rise in population.
The honourable member makes some interesting points. What I would say, though, in Sutton, there have been a number of changes, there have been a number of closures. The stroke service was exactly one of those, when actually it did make sense to actually get immediate treatment in St George's, although it was further away, because you can get, those first few hours are really, really crucial. We also had a number of hospitals, smaller hospitals, close over many, many years. However, I would come back to the point that with these changes of closures of A&E and maternity services to concentrate into St George's, which actually, although it's only a few miles away in rush hour traffic, takes a long time to get to, when you've not necessarily got the blues and twos, the ambulance services. But if politicians were that concerned about it, I would have thought they would have done a more effective job than actually attracting a petition, which to try and get tens of thousands of signatures on a petition aimed at the Primary Care Trust. And I did say the Primary Care Trust because it was still being presented 2.5 years after PCTs were abolished in favour of CCGs. But that's how long they were taking. Effectively, it was a data harvesting exercise to attract a whole load of email addresses that they could then use as a political campaign, a political football. And this is why I said it's really important that, yes, the NHS is inherently political, but sometimes we've got to take the party politics out of it and actually focus on healthcare. What we're trying to do is how do we best treat patients in a local area. St Helier, as I said, I was talking about the fact that the building is fast becoming not fit for purpose. There's 43% of the space has actually been deemed functionally unsuitable. Now, that's no way for 21st century healthcare. This is a hospital that predates the NHS by quite some way. It was actually used as the huge white building on a hill. It's actually used by the German fighters as they were to line up as they were coming in on their London bombing raids. So it is something that I'm really looking forward to seeing plans come forward that actually might use any capital funding that we can attract from the government in a very, very cost-effective way, so that we're not being too onerous to the Treasury, but that we can make all of the component parts of Epsom, St Helier, and the Sutton Hospital site as well, where the businesses, the Royal Marsden that's cited there, the Institute of Cancer Research that's cited there, and the NHS are planning a very exciting project of a London Cancer Hub to attract even more world-class research. The Institute of Cancer Research and the Marsden have got that world-class reputation, and it'd be fantastic to expand that. But the Marsden in particular needs acute facilities to support it, to support treatment there. So the more that we can use that, what is quite a huge space, frankly, for healthcare for the borough, as well as the specialist healthcare, that would be absolutely brilliant. So the Save St Helier campaign in itself is great in theory, but there are certainly some holes in their plans, because as I said, you have unintended consequences. You may well get the opposite of what you want, because the BSBV campaign, St Helier sitting in between Kingston Hospital, St George's, Croydon University Hospital and Epsom Hospital is always at threat because of the way that the catchment area is designed. And I know that the Trust are acutely aware of that. I think if we can mesh the St Helier into the London Cancer Hub and actually have an integrated approach. We've already heard the fact that the NHS can be somewhat bureaucratic. I was on actually a hospital that did close a little earlier a few years back, the Queen Mary's Hospital for Children, was that we eventually sold to build a secondary school in Sutton, as well as some houses. But it took 2 years for two public bodies, the local authority and the NHS, to actually agree terms. And that was £1 million of legal fees to actually get to the point. So lawyers got fat, children didn't get educated for another 2 years, where we had a shortage of school places at the time. And it's cutting through that bureaucracy, making sure that we can get the healthcare that we want without having to go through the 11 tiers that the member for Harrow East was referring to earlier, would be fantastic. The GP structure, we've heard a little bit about the difficulties of getting GP appointments as well. And we've also heard about how infrastructure in London doesn't always keep up with planning, with the need for demand and supply of housing. There is no difference in Sutton as well. Worcester Park, one of the densest wards on the border with Kingston, actually has 2 vets and no GPs, which I think is slightly, I'm not sure if that tells you more about Worcester Park or what it tells you, frankly, but certainly a lack of planning there somewhere. Whereas I live in Carshalton, and I live in the one Liberal Democrat MP who was in his place actually is my MP. And there is a health centre there that actually is a really good example of how we might roll things up across Sutton, but in other areas as well, where there are 2 practices that have come together in a purpose-built building, where not only do you have the shared practices, so it's slightly easier to get an appointment, not necessarily with your named doctor, but with one of their colleagues. You can wait to see your named doctor, but you can always get a reasonably quick appointment if need be, if it's an emergency. But you can also have blood tests. There's antenatal care there as well. There are vaccinations. I had my rabies vaccination there just recently. That wasn't that was actually for a trip to Burma. That wasn't in prospect of any hostile members of the opposition over the other side. But it's really the range of facilities that are there actually does help keep people, as we heard before, away from A&E, away from the pressure and being forced and feeling that they're being backed into going into A&E. And that brings me on to community pharmacies as well. I've actually been to visit a number of pharmacies in my local area, and I know they are concerned about the things that are going around about closures, but actually reading some of the things that the Minister has been talking about, he's talking about putting extra funding in. He's talking about integrating the services, pharmacy services, to actually bring it in as an alternative place to go for people for the first port of call. And if we...
As far as I understand, the block grant, I thank the honourable gentleman for giving way, the block grant that pharmacists receive for doing things like driving around and delivering medicines is being cut by 6%, is it not? And yeah.
I think my understanding is that it may change from pharmacy to pharmacy, and whereas it's important, it's important that actually what we look at when we're looking at pharmacies is that we can still, however it's carved up, that we can offer the range of services in a given area. I was at a pharmacy last week where they had a needle exchange program, whereas just around the corner they don't offer that. So it's important that there is a range of services within a given area. Yeah.
Grateful to the honourable gentleman for giving way. He's referring to community pharmacies. I think one of the latest estimates with regard to the government's proposals is that up to 3,000 community pharmacies could actually close. And so I just wonder what impact he believes that would have on his constituents.
Mr. Scully.
Well, this is something, again, as I say, the pharmacists raised with me last week, and I'm meeting a delegation of them next week as well. I think we need to see, rather than the estimates, I want to see more detail on that and actually work out how we can give pharmacies more information, more data, more space in terms of using their consulting rooms effectively to be able to actually make them that true first port of call. Because one thing that occurs to me is that people tend to look at their GPs when they are ill. Whereas pharmacists, especially the ones that deliver and that go into people's homes, they actually can see people in their homes, and they get other indicators that may actually predict other illnesses. So any preventative measures that you can make through your community pharmacists, I think, would be a very useful thing to do. I come back to the fact that, in conclusion, that I really don't want to see hospitals and healthcare used certainly in Sutton, but I'm sure across London, as a political football. I want to make sure that, yes, we have good healthcare, excellent healthcare in St Helier, but it's not about saving St Helier per se. It's about saving and protecting local healthcare to make sure that every one of the 190-odd thousand residents in the London Borough of Sutton can get easy access to a GP, easy access to a community pharmacy, easy access to A&E, maternity services, children's services, daycare, and all of the range of services within their local area. I want to make sure that they can do that in a building that's not actually making them feel worse by the very nature, the very design, and the very crumbling fabric, but a building that is actually designed to help them get better. I'd just also like to actually, in terms of innovation, one thing that Sutton has done particularly well, it's one of two boroughs, two trusts in London that actually is running a vanguard scheme on nursing homes. It's this kind of innovation that actually that is really interesting. When actually effectively a group of nursing homes have got together in Sutton and with the hospital trust, and there are ward rounds going around in the nursing home, so that they're not having to come into hospital. So again, this idea that we can avoid people having to come into hospital, which is not usually the best place to recuperate. It's obviously best to get your treatment, but it's not the best place to recuperate. So the more that we can be working effectively out in the field, out in people's homes, out in the care homes, the better. And I think it's these collection of innovations that I really want to see develop over the next few years for an excellent healthcare in Sutton. Thank you, Mr. Turner.
Ms. Kate